Hey guys, welcome to the I Hope They Hear This podcast, coming at you with another remote episode. And we have a very special guest today. I want to say Miss Hannah Lee, but I'm going to say soon to be Dr. Hannah Lee, right? Because you
Oh
are working on your
gosh.
doctorate degree.
Mm.
Thank you so much for being on with us.
Yeah,
Um,
thank you for having me.
yeah, and so I thought having you on would be really great because kind of the field of study that you're in and kind of your experience day to day, what you do at the clinic that you were telling me about. Um, and I think it's going to be really eye opening and I think it's going to be a conversation that is going to resonate with a lot of our audience.
Mm.
But before we get into all of that, I kind of want to hear about how you got to where you are now. I see that Harvard flag in the back.
Oh, that is my mom's doing. Oh my gosh, embarrassing.
so yeah,
Anyway.
you like the story to how you ended up at Harvard and how
Mm.
you ended up back or how you ended up in Atlanta. That kind of whole story, if you don't mind sharing with us.
Yeah, absolutely. So first, thank you so much for having me. Um, I am really excited just to be able to talk to you today just about mental health and about being Asian American, all that good stuff. I think I would first probably start like my story of how I got into what I'm doing now. When I was in college, I was actually an international studies major with, I don't know, I was like double majoring in political science,
Hmm.
and I thought I wanted to go to law school and actually eventually end up in diplomacy. That
I
was like
see.
the like my parents do something prestigious, you know? Um, so I thought that was kind of the route that I wanted to take because I was always really interested in culture
Mm,
and how it shapes like interactions between nations. And
mm,
so that's kind of the route that I took. But and I actually really love my international studies classes. Political science, not so much. All you
mm,
do is read Plato and I don't know, have like discourse about,
mm.
I don't know, dead people. But I actually took like a intro what is the meaning of life kind of psychology class as like as an elective.
Oh, interesting.
And I had taken psychology in high school like most of us have, and never really got that interested in it, and or at least thought it was kind of a those one of those like side subjects,
Hmm.
like you can't make any money off of it, you can't have a real career from it.
Yeah.
Just like I don't know, it wasn't actually an actual option. But I took this class, and it just got me interested in, I think, psychological constructs. And then because as I was near my graduation date, I just needed to just fill like my, I don't know, list of classes. And so I ended up taking a multiculturalism and social justice in counseling psychology class. Like that was actually the name of the
Oh.
course.
Hmm.
Um, and I think that just kind of changed everything for me.
Mm,
We talked about, culture, something, again, I've always been really passionate about, but we talked about it in a way where it really felt meaningful to the day-to-day lives of especially marginalized people,
mm.
people on the outskirts, minority communities. And I guess kind of backtracking, I immigrated here when I was 7. I was born in Korea, finished up to first grade there. Um, and we moved to Florida, of all places, our family. Um,
What
and I
city?
grew, oh gosh, okay. So we moved to a city called Ala, Florida, where there is a population of like 300 horses and like 300 people. It's I'm sorry for anyone that like loves Ocala and lives there. But like yeah, just being completely non-English speaking, right? Being plopped in a new country. I think that was
Mm,
not the best place for it or for our immigration to kind of
mm,
start.
mm,
But we eventually ended up moving to Orlando, which was much better.
mm.
And yeah, but still, I grew up in a really predominantly white neighborhood. and my parents own like a small grocery store most of my life in a low income neighborhood, and just kind of their very visceral experiences with racism and even just violence, in the neighborhood that they owned the store at. Like lots of shootings, a lot of robberies, including my parents' store. It was kind of a, like, I don't know, every 3 months we'd get a call from the police, saying like your store is broken into. It was one of those situations. Yeah. And so I don't know. And so I think like having watched my parents go through that experience, but us living in such kind of a white picket fence, I don't know, A grade school, all of that was very, it was just a lot of code switching for me, because I knew a big part of my immigrant identity and my parents and family, like all of that was rooted in kind of our lives as immigrants and as minorities, but again trying to fit into this like white community. I grew up just very confused, and so during just kind of going back to this college class that I took, it was a space where not only were those experiences just taught about in a scientific and research focused way, where psychologists were doing scholarly work on trying to capture these experiences, and not only just saying that this is stressful or this is a thing. They were also able to pinpoint kind of all the psychological aspects and the costs it was really having to people.
Wow.
So, detriments to their physical health, educational attainment, all of these things, right? Psychology bleeds into every aspect of the human experience. And so I just found it fascinating, and that's kind of why I pivoted. I still graduated with an international studies degree, but that's kind of when I set my sights, I think, into pursuing graduate school.
So after you graduated with your international studies?
Studies, yeah.
Did you do anything with it? Or was it like you went directly into your graduate studies?
Yeah, so I had a little bit of time before I went to Boston, and that's actually a pretty funny story too. And this is maybe where I would like the true origins of kind of how I came to be here is. So when I was 10, and right, like when we had moved to Orlando and lived there just for a couple of years, this professor, her name is Dr. Josephine Kim. I think I have a picture of her actually, like right up on my corkboard somewhere. I'll show you guys later if you want to see it. But she is kind of a renowned Korean American professor at Harvard, and she is connected with my pastor from my home church, and because they're kind of from that like the same DC, Virginia area. And so she had come to our church when I was 10 to give a talk on intergenerational conflict between Korean parents and their second generation kids. And so that conversation, I remember even at 10 years old, just it being like such a it was so capturing to my heart. No, I was 12. Sorry, not 10. I was 12. I was in 7th grade. Okay. And just what she talked about changed me. And I was sitting with my parents when I was like listening to this talk, because of course every Korean person in Florida came for a talk from a professor at Harvard. And I just remember her saying the words that I had wanted to say to my parents. I wasn't obviously that old, but all the ways that I wanted to be understood by them, essentially. I felt like she was capturing that for me. And it was a really healing moment for us. She was kind of this like medium almost between like my parents and I. And so we like cried together and prayed together. It was a really significant moment. And I was 12. And then like fast forward, so after college, I actually had kept in touch with Dr. Joe like intermittently. So a couple times throughout high school and then a couple times throughout college, just because she had such a big impact in my life. But, of course it was always like, oh, like, how are you? Like, how are things? And she would ask me like, how are your studies? things like that. But after I graduated, when I was applying for grad school, she came to mind, and I was like, there's no way I'm like smart enough, good enough, I don't know, like to ever even consider Harvard. But she came to mind, and just kind of the impact she had in my life. And so I emailed her and asked like what program, because there's 13 programs in the master's kind of like department at the Harvard Graduate School of Education, which is where I went. And so I asked what like program she's most affiliated with. And it was the one that I was also like interested in applying to if I was going to apply. And
Wow.
so I just kind of took it as a sign, and I applied to Harvard amongst other like very good schools that
Mhm.
I, would have been thrilled to go to, any of them. And yeah, and then this is actually pretty crazy. I found out I got in, and this is, I think, why I mistook my like 10, 12 thing. But I found out I got in when I was 22. So it
Mhm.
had been exactly 10 years since I had first heard Dr. Joe
Oh,
speak.
wow.
Yeah.
Mhm.
And this is, I think, maybe the crazier part. Um, I was actually in Atlanta when I found out.
Huh.
So I was renewing my passport because I was going on a mission trip to Ecuador. And
Mhm.
so I was here, and obviously when I finished my master's degree, I had no idea I would end up in Atlanta, but it was just kind of a full circle thing. So she had a really big impact, but I think there was a lot of kind of orchestration
Mhm.
that I could have never expected.
Wait, so
So
why were you in Atlanta to get your passport renewed?
because I'm a green card holder,
Mhm.
and the Korean Consulate General's office is here. And so, like, if you're not a citizen, that's like where
Oh.
you have to go do it. So I drove from Florida to Atlanta
Oh,
to get my
wow.
passport renewed.
Oh, I
Hmm.
see. Oh, interesting. Wow, that is crazy. Yeah.
Yeah, full circle.
Yeah, yeah. So when you
Yeah.
actually went to Harvard, did you get to meet her and
Yeah, yeah. I mean, I took classes with her. I chaired a conference that she is the department head for. It's
Mhm.
called Let's Talk, and it's a conference dedicated to Asian and Asian American student mental health. And the year that I chaired the conference, we focused on college student mental health
Mhm.
because that was kind of when there was a peak in suicide rate for Asian American college students.
Mhm.
But traditionally, it had been a conference dedicated to um, doing work with parents, kids, much like that talk that she gave at my church, but also education and mental health practitioners. So kind of the whole gamut.
Wow.
And it's still like an ongoing conference. I went back the year after and was like a speaker for it. And so I got to work
Wow.
with her really closely in that capacity. And
Mhm.
yeah, and she taught my classes, and um, she mentored me, and I still like text her all the time. So
Wow.
yeah.
So what is the name of the your graduate program?
Yeah, it's called Prevention Science Practice. So
Okay.
we called it PSP for short.
Mhm.
Um, and there's three branches. So there's one for practitioners, and then there's three strands: practice, research, and oh gosh, wait, was there two? No, there's three. Maybe there was two.
Mhm.
Now it's like, oh man, my memory is getting the best of me. But it was practice and research, and I was in the research strand.
Mm.
And so yeah, it was and then counseling was the third strand. But it was for school counseling, which is a little bit different than what I do, like with what I do for work
Mhm.
now. Um, so those were like the three branches, and I was in the research strand.
Okay. Fun fact, two episodes before this one, I
Mhm.
actually had a school counselor on.
I saw that.
Yeah. So no, it's
Yeah,
connection there. So
yeah,
what is the difference between like practice, research, and the counseling aspects
mm,
of that program?
yeah. So, school counseling is pretty like straightforward. It's kind of mental health practitioners, but particularly only in a school setting,
Mhm.
and obviously kind of in the like first to 12th grade space.
Mhm.
and practice were folks that wanted to go into different aspects of education. So I have friends that were in the practice strand now that work for like higher education. So they're in like advising departments, doing program evaluations, and different even like policy roles. Folks just ended up in kind of a wide gamut of things. Like I have
Wow.
friends that are consultants. Yeah, so that's kind of the practice strand. It's supposed to encompass people that don't want to either go into like a strictly counseling role or a research role.
Mhm.
And then research is kind of self-explanatory. We researched kind of aspects of prevention science.
Hmm. And when you say prevention science, is that what exactly are you trying to prevent?
Yeah. So I would describe my program as kind of a crossover between public health and education.
Mhm.
So that's why it was a really good fit for me, because I was able to tackle or learn and tackle issues through projects related to mental health, and specifically Korean student mental health. Um, but a lot of the focus of our program is like program evaluation. So are we able to, like, is this program that has a lot of funding and has a lot of manpower, or is this nonprofit that's supposed to be serving like these specific needs of the community? Are they doing a good job at it? Basically, is it
Mm.
data driven? Like how are, analyses of these research projects being translated into practice? So
Mm.
it does a little bit of that role of connecting the two. So we had people work with depressed mothers and how that influences, like outcomes for their kids long term. So it was a very
Hmm.
interesting and very specific field, but it was fascinating.
Hmm.
Yeah.
So when you were the program, you know, track that you were on with research,
Mhm.
is that research meant to inform like policies and things like that for the general public, or is it like specifically to influence how, I don't know, like counseling or therapy works?
Yeah. So so the research strand was special because uh, all the strands have a specific advisor,
Hmm.
and my advisor, Dr. Nancy Hill, super renowned researcher and scholar in the field of kind of adolescent and youth mental health,
Hmm.
but in general, super well published. But I would say that the research strand's goal was mostly for scholarship. So, and this is kind of something that, like, an issue that I would want to resolve with research, actually, because it ends up staying within the ivory towers of academia. The goal, obviously, is to want to translate into practitioners, and practitioners include counselors. But a lot of the times, like, that's not the case. Scholars will do their research, publish in their esteemed peer-reviewed journals, and that's kind of where the information will stay amongst the very well-educated, right? And it doesn't translate into the depressed mother in a low-income neighborhood.
Mm.
Um, but yeah, I would say because of the nature of our program, because we were collaborative with practitioners, we had hoped that our research would translate into practice. But again, that's kind of another beast.
Mm.
But it was like a ideal goal, if you
I
would
see.
say.
I see. So, I mean, for you personally, going from Florida to Boston, I mean, like
Mhm.
in a lot of different levels, it's a very big transition, right? Like weather, I mean, even just, I'm sure the culture is very different. The people are very different.
Mhm.
How was that for you? Was that an easy transition? Or?
So I think yes. So the answer is yes.
Mhm.
I actually think the Northeast is a much better fit for me as a person.
Mm.
I think by the time I was leaving Florida, I was ready. I was ready. I was just
Uh,
like, it is so hot down
uh-huh.
here. And I went to school at the University of Florida, so it was Gainesville. There's literally nothing but UF,
Hmm.
and like our hospital there that's really big.
Hmm.
And I was just like ready to get out. And
Hmm.
the pace was really slow. The people I had known, ever since I basically had moved to America,
Hmm. Hmm.
and I was really ready. And I think when I went, It was really the experience of a lifetime. I adjusted. I mean, my program, or Harvard in general attracts people from all over the world, like, so I had classmates from Egypt and like Nairobi, and also Florida,
Mm-hmm.
lots from California. So it was just a really global experience. And so I think, and then you're thrown into this pot of an experience, and everyone's excited to be there and everybody wants to connect. And so that was really natural, I think, because we were
Yeah.
all new and we were all pretty much kind of moving from somewhere else to Cambridge, that it was easy to make friends. Obviously, these people are really motivated, really smart, really interesting, and really really big, like, fun party people. And so we had like the best like get-togethers, and I think the transition was actually really easy. And I would probably say that live when I was in Boston, I was probably the most happy, fulfilled, yeah, content. So
Mm.
I loved my time there.
Wow. When you were in Korea, what were you in Seoul?
Hmm. I was.
I wonder, because so this is a theory that I have. I also was born in Korea, lived in a big city until I was 6, and then I moved to LA, but it was the suburbs of LA, so like we were nowhere near downtown.
Yeah.
But I kind of feel that I'm more of a city type of person too.
Hmm.
Living in the suburbs of LA and living in, the suburbs of Atlanta has always felt a little slow for me. Is it
Yeah.
possible that at that young of an age that
Hmm.
that your environment would have left like a life-changing mark on kind of your psyche and where you feel comfortable? Is that possible?
So I guess it depends on how young you are.
Mm,
Developmentally, usually, like, psychologists will think the lifespan into chunks. So pre-adolescence, adolescence, and adulthood, and it's divided into those chunks because what determines kind of your psyche fits within those age periods. I think me the bigger transition was going from just Korea to America. I didn't speak like a lick of English. I mean, I was 7,
mm,
and so I think that was a bigger transition. And I got bullied a lot when I like first moved here. Kids are so mean. I was in
mm,
second grade, and like I couldn't speak English, and I didn't
mm,
know what was going on. And yeah, it was more of that transition than kind of the
mm.
pace of things.
I
But
see.
I think and on an individual level, it could have been much more significant for you, that kind of like change of pace, um, because I think I was going through more of that like language barrier, the classic, I don't know, immigrant experience.
Yeah, no, I mean that makes sense as well because those are all things I went through as well. I started with first grade when I first came to America,
Hmm.
so I think kids were a little bit more forgiving for whatever reason. I don't remember getting bullied too much, although I did get bullied a little bit.
Mm-hmm.
So yeah, no, I I was just as you were talking, it I could relate. So I wanted to take
Yeah.
the chance to ask you, yeah, if you had any opinions about why. Do you feel like that's something a lot of Asian American immigrants go through in terms of um, being impacted by that move and having some sort of, I don't know,
Mhm.
like the experience that we have with wanting a faster pace environment? Like, is that just us two, or is it on an individual level, or is that something that you've kind of observed on the larger Asian American population here in Atlanta?
I guess so. I don't think Atlanta is actually very interesting
Mm,
because a lot of the Korean Americans that I have interacted with here are actually born and raised here.
mm,
And even folks that moved away from college, they came back, or they born and raised, went to high school, and then went to like one of the Atlanta schools, like JSU, Georgia Tech, Emory, UGA,
right.
and then they kind of went back to wherever they were from, and they kind of like, or they live in Midtown somewhere.
Mhm.
And so I think like, it's hard to speak to that because I think my network has more of like those people. But I think kind of by and large, yeah, I think Asian Americans definitely have a hard time transitioning, especially if they're immigrants, wherever they are, and obviously that experience will be exacerbated depending on where you live. I would imagine that an Asian American immigrant child who lives in North Dakota is going to have much more of a visceral experience than an Asian American immigrant that moves to LA, right,
Mm.
in like K-Town. And so, yeah, I think it's contextual for sure, but there's a lot of protective factors, right? Like the consistency of their parents and kind of the cultural education that they're getting at home. Like
Mm.
if the parents are able to integrate a bicultural identity for their child, if they know what that even means, right?
Mm.
If the parents are English speaking and or blue collared or white collar jobs, right? Like all of these like, ecological things I think kind of really impact the experience of even the individual. So it's
Mm.
it's hard to say kind of at large, but for the most part, I think nerd moment, like what research says is that a lot of Asian Americans do experience feelings of marginalization, and there are significant differences within generations. So first generation, as in like immigrants,
Mhm.
and then 1.5, that kind of in the middle, and the second generation all do experience that acculturating stress, so acculturative stress, but it's for different reasons actually, which is really fascinating.
Interesting. Let's hold that thought because I want to get back to that. But
Yeah.
before we get to that, I want to talk about um, yeah, like your current study, because you are you're getting your doctorate degree,
I
and yeah,
am.
and so if you could,
Anything now.
so if you could talk about what you're studying and what that's all about, that'd be
Yeah,
great. Yeah.
sure. So when I'm asked this question, I say that I study Asian American mental health at large,
Mm.
but I have a specific like project going on right now. It's my pre-dissertation, and it's on the acculturative stress. It's on acculturative stress and its relationship to self-esteem and how a sense of belonging and social self-efficacy mediate that relationship. And
Mm.
kind of in layman's terms, it's basically does social self-efficacy, which is this sense of confidence that you are going to be able to handle yourself and be accepted for who you are in a social setting. That and sense of belonging, pretty self-explanatory, but how those two things kind of explain this relationship between acculturative stress and self-esteem. And usually those are, so if there's higher acculturative stress, then there is lower, so they're negatively correlated, right? So if there's higher acculturative stress, then there's lower self-esteem. But if there's lower acculturative stress, as in it's easier for you to adjust, adapt, and acculturate, then there's self-esteem. So
Mm.
that's kind of what I study in particular, but I am interested in a lot of different things, trauma, like the immigrant experience, like with language barriers, access to resources, psychological help seeking.
Mm.
Yeah, but that's my specific kind of one thing going on right now.
Mm. And I think you kind of explained it along the way, but just so I'm clear, can you kind of define acculturative stress one more time?
Yeah, yeah. So, for mostly immigrants, like all of these kind of constructs have been mostly applied to an immigrant population, but it can be applicable to any marginalized person. But there
Mm.
are couple of choices of what happens psychologically when you are adjusting or adapting or developing as a person with marginalized identities or one marginalized identity.
Mm.
And people will either assimilate or acculturate or kind of avoid and or reject. And so these kind of three options. So assimilate is you assimilate into the culture. So for I think a lot of us, especially East Asians, when we do assimilate, we try to assimilate into white people.
Mm.
And this is kind of your like that like one Korean kid that's in a fraternity and
Right.
white fraternity and has no Korean friends, and like that's kind of like that is the way to live for them.
Mm,
That's kind of, I think, the best example that I can give for assimilation.
mm,
They don't give kind of much thought to their culture, heritage culture, and they assimilate to kind of or a majority more popular societal kind of trends. But it doesn't always have to be like white folks. I think there are a lot of Asian Americans that grew up with African Americans and Latinx folks, kind of
mhm,
depending on the community that you were brought up. Because I think large Asian American communities are pretty rare in the US and very geographically determined. If you did grow up with a different kind of group, then it's more likely that you assimilate. Acculturate is, uh, I guess, the more positive version of that. You go through a process. You definitely kind of are juggling between your heritage culture and the mainstream culture, and you're
mm,
trying to go through a process of where you're kind of internalizing these two cultures and really doing kind of a value management process of like keeping what is good and distancing the things that you feel like aren't helpful for you,
mm,
depending on kind of your values and also how you were brought up and like kind of all of your context and um, upbringing. Kind of that rejection is almost that extreme spectrum where folks will like hate being Asian, and they will really reject that identity, reject that culture, and oftentimes there's a lot of hurt behind that
mm,
or underneath that, and yeah, but I that's definitely an experience that I think Asian Americans go through
mm. I see.
too.
So, and when you were talking about acculturative stress, it's the stress. It's basically the stress of. Is it kind of like juggling cultures? Is that kind of a simple way to put it?
Yeah, so it's the stress that you gain from that process of
Mm,
internalizing the two
mm,
cultures, right? And so, as a Korean American, there are many aspects of me that are Korean to the core. You can't take it out of me, and there are of me very American too. And there are parts of me that get frustrated with Korean culture because of my American identity.
right.
So it's that process of truly becoming like Korean American. And I think that is kind of a subjective definition. You can, define where you would like, but there definitely is a third culture that is um, Korean American, right? As
Mm,
opposed to kind of being like a first generation Korean and then like not Asian American or not Korean at all,
right.
right? So that like internalizing and making that your own, that Korean American bicultural identity.
Mm,
So the stress that you experience from kind of that process.
mm. Wow, wow. And so that's kind of what you're studying.
Mhm.
And you mentioned how you work at a clinic as a
Mhm.
therapist, right? Um,
I do.
so does your work with those people, I guess patients that come to see you,
Mhm.
is that mostly focusing on the stresses that they have due to being an immigrant, or is it just
Mhm.
a wide range of things?
Yeah, so it is actually more of a wide range of things. My patient caseload goes from as young as age 10
Wow.
to I think the oldest person I'm seeing now is 52. And
Wow.
so, right, like very, very different things that they're coming in for.
Mhm,
So it's not right, just kind of that immigrant experience, but a lot of the times, and all of my patients are Korean except one. I
mhm,
have a South Asian a female client, and she's awesome. Love her so much. It's actually really fun doing therapy with her because we relate like on a lot of things. So
mhm, mhm,
um, yeah, really like her. But except for her, all of my patients are Korean.
mhm,
Um, but they come to our clinic because they're looking for that shared experience. So even if they're not coming in with that, like,
mm,
hey, like I'm an immigrant, so this is what I'm struggling with because of my identity. I actually think a lot of people don't think about that on a day-to-day basis or even like really in depth if they don't ever really have to face, having to think about it in depth.
Hmm.
But they come to our clinic or look for me because there's this shared understanding, right? Like you're Korean, I'm Korean, and you're going to get the cultural nuances.
Right.
Um, of my experience. So even if someone is coming in with depression because they're going through divorce, um, there's a specific way that they have thought about marriage and relationships, and a significant other and what that looks like for them that has largely been influenced by their identity of being Korean or being raised by Korean parents, and their example of a marriage is our Korean parents, right? And so it all is integrated into kind of that therapeutic experience
Mm.
for all of my patients. And um, like scholastically too, it is the most important for Asian Americans to have an ethnic match with their counselor, their therapist, than any other racial ethnic group,
That's
which
interesting.
is which I think says something. Yeah.
Hmm. So you're saying that is that a preference thing or is that an effectiveness thing?
It's a preference thing. So
Mm.
actually, like, yeah, so within research, literature says that there's actually not that big of a difference of kind of who you go to. The only difference that will make is if you don't go to a multiculturally competent clinician,
Mm.
then that will be a very negative experience for you.
Hmm.
But if you can go to one, their racial and ethnic identity actually doesn't matter. But again, um, I think Asian Americans tend to kind of look for Asian American clinicians, and this is like a whole nother thing. But
Hmm.
I think that has a lot to do with like shame and stigma, and kind of
Right.
what's associated with mental health and that, and
Mm.
kind of that mistrust with Americans or people that are not of the same in group as us, right? We
Mm.
consider that very important because we're collective, and we kind of keep the struggles we go through within us, right? Because it's shameful to let that out to anyone
Mm.
else. And invite them into kind of our struggles and our trials and tribulations. So
Mm.
I think that speaks to the ethnic match preference.
Oh, interesting. When you talked about stigma, I was actually surprised to hear that there's a 50-something-year-old that comes to see you because the older, oh, at least observationally, from my small circle that I'm seeing is the older a immigrant Korean American is, the
Mhm.
less likely they are to be willing to go into something like therapy or counseling, right? That's a stigma
Yeah.
that Koreans, well, I don't know about Koreans, but at least for the immigrant Korean Americans that they have, right?
Yeah.
So
Yeah.
do you still see that for the people that you see who are younger, do you still see that as kind of a stigma that they have to get over, or is that by and large gone in the second generation?
I wouldn't say it's gone. I think it's,
Hmm.
because that shame and stigma is generational in and of itself, in its nature, right?
Hmm.
Like if our parents think mental health is dangerous and it means that you're psychotic, when there's nothing wrong if you're psychotic. Mental illness is a very real thing, like any other sickness in the world, right?
Hmm.
Um, but I think because of kind of that understanding and this fear around mental illness, and that was what our parents' generation really grew up with, and particularly that, right, like survival mentality of our immigrant parent generation. I think we inherited that, right? And
Hmm.
so even as somebody that works in this field, and being I'm 1.5, 1.5 generation,
Hmm.
but large, having spent life in America, that those conversations are still really hard to have with my friends, because they're just
Hmm.
kind of like, and I see that even in my patients too. It's just like it was really hard for them to come to me, and when they made that decision, it was like a big one for
Hmm.
them.
Wow.
Mhm.
So when are you going to be finishing up your studies? Are you close or?
Not close enough. Um, no, actually, it's speeding by. So I'm at the end of my second year, which
Mhm.
is I barely got used to saying that I was in my second year.
Uh-huh.
Um, And how like it works for us, I have 4 years and then like on campus of clinical and didactic training
Mm,
and with research, and then I have a 5th year residency, so internship year.
mm,
And that 5th year is a very similar process to like med school. There's a matching process, um,
um,
but our 4th year is largely applying for that residency and internship
mm,
and doing our dissertation. So the 3rd year, which is what I'm coming up on, is kind of my last year taking classes. But yeah, I will be seeing patients all throughout until I'm done.
mm,
So that stays pretty consistent, but I'm kind of done with like taking classes and stuff, which feels good.
nice.
So technically, my I still have 3 years left,
Mm,
but they all look pretty different. And so I think that's what it feels like. It's going to go by fast because
mm.
it's not like the same thing, you know?
So once you graduate and you get your doctorate degree, do you hope to be doing something similar to what you're doing now, or are you looking to do something completely different?
Mhm. Yeah, I ask myself that question every day. I'm like, why am I getting my PhD? What am I going to do? um, so I came into like my doctor program wanting to be a professor. Like I thought I wanted to stay in
Oh,
academia
mm,
and teach and continue to do research. But I actually love clinical work much, much more than I had imagined.
mm,
Um, and I think a little bit of that is because of that conditioning of like you need to do something prestigious. So like like
right.
academia was made so much sense.
Mm,
But as I'm working with families and individuals and couples, like just the healing that I'm able to be a part of in their lives that means so
mm,
much to them, and the transformations that I see kind of in their day to day, there's just no like other work like it, and I really want to stay in practice, but I actually kind of want to take a non-traditional route. I think after I graduate, I want to do practice for a little bit and find a way where I am still able to engage in research. So maybe like kind of do an adjunct position or something like that. Um, but I think I want to go into partial consulting, but also like start my own business.
cool.
And yeah, I haven't fleshed that out yet, but like something along the lines of kind of psychoeducation with Asian
Mm,
American families um, and like individuals and like nonprofits that are dedicated to kind of Asian American communities, immigrant communities, something along those lines.
mm.
So
So I
yeah,
want to ask
lots of
you,
thoughts.
yeah, I want to ask you a personal question.
Yeah.
So y- as Asian Americans, we know that our parents can be very, with good intentions, they can demand a lot from us, right? In terms of like you were talking about prestige and things like that. Do you feel
Mhm.
like you fulfilled that with your parents by going to Harvard already, or are they still kind of wanting you to up, get to the next level, whatever that may be?
Um, yeah, I think I gave them like everything they needed by going to Harvard. Now I'm just kind of like, what are you gonna say to me? What do you know?
Right.
Um, I'm just kidding. No, my mom still yells at me that like I don't do the dishes correctly. I think, yeah. I mean, I felt really blessed that I actually like my parents did want me to do something prestigious, but they always added the clause of do something that you love and do
Mm,
something that you feel like you can be good at, and at the end of the day, like where you feel proud of yourself.
mm,
Um, and so they never pushed me into medicine because I hated biology, so it was like that wasn't the clause. And even when I was done with my master's degree, um, my parents definitely weren't like, okay, like time to become a doctor. They always gave me the option. They were like, yeah, go work or, like, please make some money. Um, because I've been like such a perpetual student.
mm,
Or they were like, just do what feels like would be fulfilling for you. So
mm.
I think it's because like I love learning and I love school. I'm getting a little tired of it now, but um, I think it was like really my own decision that made me kind of um, like take the PhD route.
Mm,
But but yeah, my parents weren't unhappy about it. They weren't like, "You're gonna get your doctorate? That's stupid." Yeah,
I see. Oh, that's awesome. So then I want to shift gears a little bit. We kind of talked
sure.
about your journey, how you went from being an immigrant to kind of studying what influences, impacts the Asian American or just immigrant stress factors and things like that, right? But
Mhm,
I
mhm,
wanted to ask specifically for Asian Americans. You can talk statistics or your own anecdotal experience, but
mhm.
what are some of the most what are some of the biggest obstacles or biggest struggles that you see Asian American immigrants kind of dealing with?
Mm. Oh gosh, by and large, family issues. Yeah, I
Mm,
think that's
wow.
always something that comes up for like for my clinical cases, even like within scholarship. So APA, the American Psychological Association, obviously kind of this like godfather governing body of my profession, has all these sub branches where these divisions kind of focus on a specific group. And so there's one called the Asian American Psychological Association. And it's like a community of Asian American psychologists, researchers, scholars, and they publish kind of a big bulk of what's out there about Asian American mental health. And a lot of kind of what they write about is kind of that piece about the stress, the culture of stress, and kind of stress related to racism,
Mm,
like cultural misunderstandings, code switching, things like that. So that's kind of the academic part. But I think in my clinical work, it has been a lot of like family things. I like never felt that my um, mom really saw me for who I am, and she just didn't have the language to, right? And kind of there was always a mismatch between like I know my parents love me, but I don't they don't show me in the way that I understand it.
mm,
So I kind of always grew up feeling without, or I worked so hard to prove myself and it like is never enough. Like, am I never enough?
mm,
So I think anecdotally, in terms of kind of my clinical work and what's out there in the research, obviously, although what I mentioned isn't expansive, um, differs a little bit, but it still speaks to kind of one and the same, right? Because I think that cultural difference between generations, um, there is a big reason why mental health is becoming such a big concern for Asian Americans.
oh, so when you say family, is it predominantly like the parental relationship, parents and offspring, or do you see any issues with, like, for example, siblings, or maybe spouse,
Mhm.
I don't know, uncles, aunts, it,
Always like an uncle in there, right? It depends because I have cases that are all like very independent. So I have a case
mm,
that is like a relationship, their marriage,
mhm.
and then I have a case where kid like sisters are fighting, like kids are fighting, but it's because after you kind of see the root of it, it's because of the comparison like that
Mm,
mom perpetuates on the kids, that they
sounds
feel like
familiar.
they have to be in competition with each other. And then you dig a little bit deeper into that, and it's because mom struggles a lot with depression and suicidal
Mm,
thoughts,
oh
right?
wow.
And so kind of her emotion regulation is off, so she's like spewing off to her kids, and then like that's making them fight with each other. But the reason for why they would come to counseling is because like mom is stressed out that the kids are fighting so much, right? But like there's all these like underneath layers that are influencing this like one presenting concern. So it's hard to say like this
Wow.
one thing or
Mm,
generalizable common experience because yeah, folks are just coming in with like all the different things.
wow. Wow.
Yeah.
No, I think that's great. Because I think it's important to be open about the wide gamut of
Mm,
issues and reasons why someone might go to a clinic like yours.
Mhm.
Because I think one thing that I personally would say I struggle with is I do struggle with that stigma of mental health, seeking out help
Mm.
when need be.
Mhm.
But a lot of that I think is because I don't know why other people go to see therapists, right? Like if I
Mm.
knew some of the reasons why they went, I think I would then be
Mhm.
able to say, oh, those are things I'm struggling with too. Maybe I should go see a therapist.
Mhm.
But because it's so rarely talked about in our community. I mean,
Yeah.
I'll see a white friend go to a therapist and it doesn't do anything for me, right? I'm like, okay, you're white,
Mhm.
I
Yeah.
maybe
Don't
that's
relate.
your culture, exactly. Um,
Yeah.
but when I see an Asian American going, and I know kind of generally what the issues that would warrant going to see a therapist is, I think that would help me. So yeah, anything else? Like any other reasons why people come to see you? Just so that we can kind of open the door on this for other Asian
Yeah,
Americans.
for sure. And I think this is like the very interesting thing about mental health. There is There is definitely mental illness, and that is kind of the more, serious cases.
Mm,
I have a client who does have psychotic symptoms and struggles a lot with OCD and
mm,
has to be on medication and has to be very like closely monitored. And she's pretty high crisis.
mm,
I've had, like patients tell me about their intent for suicidality. I've had to do reports, you know,
mm,
like mandatory reporting, if like, yeah, for, abuse of our informed consent. If you tell us you're going to hurt yourself, you're going to hurt somebody else, or if you let me know that a child or an elder is, in an abusive situation, we're bound by law to report them.
mm,
And I think like I've been in every one of those situations.
mm,
And so like those high crisis like people, and what they struggle with are definitely there.
mm,
And so a part of that, yeah, feels scary kind of with anything that is high crisis. But it's, like if you think about, a heart attack or a stroke or anything that is kind of on the high crisis spectrum of physical illness, right? You can
mm.
go from a cold, which is not serious, um, that's my dog barking. I don't know if you could hear that. But yeah, you could go from like a cold, or you could, or you could go into the hospital because you had a heart attack, right? So
Mhm.
there is like a spectrum, and one is more high crisis than like another, right?
Right.
It's the same thing for mental health. Like, of course, there's high crisis people. Like, this
Mm,
is a real thing. There are chemical imbalances, there are genetic components to mental illness, and it's a sickness, right? But I also have people on this other spectrum who come in because they want to understand their relational patterns, right? Like they never feel like
mm,
they are able to really connect deeply with people, and they just like don't know why, so none of their friends are meaningful. All of their relationships, kind of are like short-lived, and um, like they want to find a better kind of version of themselves and like go through an experience of self-growth, and want to be intentional about that.
mm,
I mean, don't get me wrong, there are definitely very real experiences of pain kind of in those cases that I have as well, but it's not right like psychotic symptoms. And
mm,
so I think, like you said, David, I think this gamut is really important to highlight on, right? Because mental health and psychopathology are very, very different things.
mm,
And that's kind of how I always have like talked about mental health, and just like, yes, of course it encompasses high crisis cases. Like, we're healthcare providers. We are bound by HIPAA, like, um, yeah, like insurance pays us,
mhm,
so a lot of the times, like, we just kind of have to change the language to being exactly the same as physical health, right?
mm,
And I think that is that's helpful for people to hear, because of course there's more serious, and then there's ones that you're doing as a checkup, as kind of a self-reflective, introspective, kind of wanting to grow and change some things that aren't serving you anymore.
mm. So what I'm hearing is really there can be any reason to go see a therapist. It doesn't have to be, I'm having suicidal thoughts or,
Mm.
it doesn't have to be high crisis, as you mentioned.
Yeah.
It can be
Yeah.
very like, checkup style. Like I just want to figure out like what's going on mentally for me, or things like that, right?
Yeah. Yeah. Absolutely.
Okay. Oh, that's good to know because I I think it might be shocking to you for you to hear. I think this past year was the
Hmm.
first time that I've understood it that way. I
Hmm.
I'm 32 years old now. Up until I
Hmm.
was 31, I think I thought that going to see a therapist was exclusively for people who were dealing with um, high grade mental illness, right?
Hmm.
Like sociopath, psychopath, all those things, right? Like very
Hmm.
severe depression, very like debilitating anxiety, things like that. So it's very interesting for me to hear that um, those aren't exclusively the reasons why you need to go see a therapist or you would want to go see a therapist. So yeah, no, thank you for sharing that. That's I, do you feel like a lot of the Asian American community doesn't know that yet? Like, am I do I sound like a
Yeah.
crazy person to you for thinking that way, or have you seen people like me too?
No, no, absolutely not. So it is the case for Asian Americans that they will come in when things are like worse than I guess other people, how
Mm,
other people would label them. So that is supported by literature.
mhm,
Asian American clients are usually at a higher crisis than, like when compared to other racial groups.
mm,
And I think again that has to do a lot with that, stigma piece.
mm,
And because our culture is so embedded within that like safe face culture too. I
mm,
think that has a big part to it, because like going to a therapist, like admitting defeat, that you can't handle it on your own, life's hardships. And I think actually a beautiful aspect of the, at least, Korean culture, and this is applicable to, I think, many Asian American cultures, are that we are just resilient,
mm,
and we got through poverty and wars and colonization and, right, immigration.
right.
And so this like survival mentality has been so crucial to our survival, and again is generational in nature, that when you kind of are struggling and you don't know what to do with this perpetual sadness or perpetual like worry, um, I don't know, like I think it feels kind of like a defeatist mentality, to have to go see a therapist
Mm,
for us because of that cultural part. But I think that's shifting a little bit, right? And so you
mhm,
mentioned it a little bit of like, oh, is it changing for our generation? The answer is not a yes or no, but there's like a slight, right, kind of change of changing the course of direction,
mm,
and that makes me really hopeful, because we're not stuck in this kind of like, well, everything has to be hard all the time for us, and we just have to grit our teeth through it, right? Our
mm,
parents came to this country and gave us all of these wonderful opportunities and worked so hard for them so that we can have a better quality of life. And
mm,
I think taking care of your mental health is a big part of that, right? And I know that it's mental health is also become kind of trendy, like in the past, like 5 years,
mhm,
and that's helped a lot with the stigma of everything. Um, but I think it has to kind of, yeah, do with that quality of life piece for folks that are on the spectrum of kind of being, like mentally ill. And
mm.
so, yeah, I don't know if that answers your question,
No, yeah,
but
yeah.
yeah, I think it is shifting a little bit for us.
Mm. So that's interesting. A question, because this podcast is called the I Hope They Hear This podcast, and the they changes every episode. So I
Mhm.
wonder, is there anything that you hope Asian Americans who are not your patients know
Mhm.
something about mental health that you feel like
Mhm.
isn't really well known?
Mm. Yeah, that's a really good question. Um, hmm. I think I hope they
Hmm.
hear that mental health is a part of every aspect of your life,
Mm,
and I said this a little bit earlier, that it will, of course, influence your physical health, the mind and body are connected. We've known that from, centuries on. And if you like think about emotions, right, they are a physical response to your processing of a certain antecedent or an event, right? And so like when you get angry, you get hot, and you get like your heart rate goes up, and like like your facial expressions change. Or when you get sad, right, like your body kind of changes, and there are different things kind of going on chemically in your brain. And so there's a lot of this that is biological, that is connected to the emotions. And the reason why I say that is I think like people separate kind of that like mind and body part, but your mental health absolutely has impacts on your physical health. And then I think because of the nature of mental health, it also has implications on the quality of your relationships, right? Like if you are a really toxic person, or just emotionally stunted, and you haven't gone through kind of the growth that you needed to, or even on the spectrum of kind of no one ever really taught you how to have healthy relational skills, and how to be intentional about doing that, then of course you don't know, right? But that's going to I think lessen the quality of your quality of your relationships in your life, and that causes a lot of distress for people, right? Dysfunction kind of in that, like interpersonal dysfunction. And mental health also bleeds a lot into how well you're able to function at work. There is a huge part of so my specific field is counseling psychology, and we have kind of an aspect of our field that is dedicated to like vocational and career counseling, because mental health absolutely affects kind of how effective that you can be in your workplace as well, and how how productive you can be, and how much you can enjoy kind of your work environment, all of that good thing, all of those good things. So it's the human experience, right? Like mental health is part of every aspect of someone's life. And so I think that's kind of that's the big picture of mental health that I would want people to know, that it's not, just kind of I don't know, I wouldn't even want to make it reductive to just going to therapy either, right? Like mental health is a state of being, just like being physically healthy is. And so, and these things are off balance, then everything else kind of is off balance as well, so it's worth taking care of, it's worth investing into, because it has long-term benefits for the quality of life that you live.
And so because you talked about the is it acultural stress,
A culture of stress.
a culture of stress,
Hmm.
and you talked about how kind of that internalizing the transition from culture to culture can cause these kind of stresses.
Hmm.
I wanted to talk about kind of current affairs. I'm sorry, the current state of things, right? With the
Yeah.
coronavirus being, I mean, by the
Mhm.
president, by it being called the Chinese virus,
Mm.
do you feel, or what kind of impact do you think that has to the Asian American immigrant psyche?
Yeah. So I have two responses to this. More, one of them is like personal, and then one
Hmm.
of them I think is kind of what APA has been saying, in kind of terms of the psychological toll that it's taken for Asian Americans.
Mm.
So first, kind of to like that aspect, I think Asian Americans are struggling a lot with the racism that's like so blatant.
Yeah.
Um, and even just the hate crimes, the violence that's happening. I read an article about like a Chinese man who was stabbed like 13 times in Chinatown because he was wearing a surgical mask. And and I was just I was just floored, and um so I think, right, even being exposed to news like that, like you just had a physical reaction to what I just told you, that like that piece of news, and us having some kind of a connection to that because of the way that we look and the culture that we share, right? Um, like that reaction is a part of kind of your psychological processing of like something horrible that happened that I told you, and right, there was a connection that you made in your humanity, that made you have a reaction, right? And so even the exposure to the racism, I think, has been hurting Asian American folks, and there are psychology, um,
Mm,
and yeah, so the APA has been a lot of guidelines and resources actually for Asian American folks to deal with their mental health and kind of what's been coming out. And even, news mediums have been putting out a lot of good stuff, and kind of like the model minority myth, or the model minority, it goes from the not model minority to yellow peril, right? This like
mm,
huge shift in kind of thinking of Asian Americans as this like perfect and obedient and pristine kind of, right, marginalized group or minority group, to now us being a threat to,
mm,
the world.
mm.
And so there are, I think, very real implications of that. I think
So,
personally, yeah, go
sorry.
ahead. No, no, no,
It
go
was
ahead.
really interesting because you said that
Mhm.
even just even if we're not experiencing the racism ourselves, exposure to
Mhm.
seeing it happen to another Asian American, you're saying that can have a psychological toll, right?
Absolutely. So it's
Wow.
called, yeah, vicarious trauma.
Mm,
And so that the spectrum of trauma can be very, very different.
mm,
Obviously, somebody that kind of hears about this piece of news and just feels horrified about it,
mm,
and experiences kind of that like visceral reaction, very different than, somebody that kind of had like maybe a family member be killed by police brutality. That's also vicarious, but it's
mm,
vicarious trauma
mm.
because of a like racially charged hate crime, right? So again, like that spectrum thing, and usually we
Wow.
kind of either fall in the middle, right? But yeah, there are many and a ton of articles and studies that have been done to show that it impacts us psychologically, um, yeah, in negative and harmful ways, to even um, be able to identify with the person that experienced it.
Then, question, because if knowing that this vicarious stress can happen
Mhm.
as an Asian American who, like, if I were to go through a racist experience,
Mhm.
should I share that with other Asian Americans,
Mhm.
or am I doing more harm by sharing it?
Yeah. So there are, so this is where it gets, I think, kind of tricky.
Mm-hmm,
I think it's first important to have Asian American experiences, good and bad, out in to the world, so that
mm-hmm,
people don't think of us as such a monolithic um, group of
mm-hmm,
people. And I think what this coronavirus stuff has really unearthed is that racism towards Asians and non or anti-Asian sentiments have always existed in this country, but have been kind of hidden, or right, there have been other, I think, kind of more pressing things, that have happened to other communities. But it always only takes one thing, you know what
yeah.
I mean, to really like kind of show people's colors. And so this is a very drastic one towards anti-sentiments.
Mm,
So I think, to like answer your question, I think it's important, that like you share your story, and that there is a more accurate depiction of what being an Asian American in the U.S. is like.
mm,
But at the same time, it's very protective. It's a protective factor for anyone that has gone through anything that's distressing, um, or like a trial, for them to gain support, the support of others, especially those that can like share that experience with you. And so yes, there is this vicarious trauma, but make sure, if you are the one that is experiencing that, you're reaching out to your network of family and friends that care about you and love you, yeah, maybe, like, I don't know, writing a long Facebook post about it, if it was a really visceral experience and like somebody else reads it and it isn't good for them, like that could happen. But it's more important, for as the person that has experienced it, for you to gain support and people to kind of be there with you.
okay, so okay, that's good to know because I'm such a I, I like to think things not in the straightforward way. So
Mhm.
when I heard that, because I do have the episode right before this, I did have a guest who did talk about kind of a racist, kind of a microaggression that he
Mhm.
experienced because of the coronavirus, and that
Yeah.
just got me thinking: should I edit that part out
Mhm.
if I'm gonna have a detrimental effect to the greater Asian American.
Oh, no, no, no. No, I think people will like, identify with it and it'd be helpful for them. But
Mm,
I think it's that like those really gruesome kind of right experiences. And
mm,
one of my like colleagues are there, she's doing a really interesting study about racial trauma, about the Charlottesville rally when
mm,
right with the KKK that happened in Virginia a couple
yeah.
years back, and kind of how African Americans experience racial trauma, even just kind of a like knowing about that experience, or even being like living in the state of Virginia. And there's like that is definitely like a thing, right?
Mm,
But again, super important for you to surround yourself with people that you feel like are going to understand you and support you.
mm, I see. I see. Sorry, and you were talking about your personal
Oh,
response.
yeah. I mean, this isn't like super important, but I before this thing like blew up,
Mm-hmm.
and it was just kind of at like oh, we're just closely monitoring. This it was already a thing. It was definitely in the news. Like people were already talking about it,
Mm-hmm.
but before it was stay home and don't leave.
Yeah.
Um, I went to Sephora to get like blush,
Mm-hmm.
and so I was at the mall. I was at Lenox, and I was like looking for shades and like looking at colors, and I like just I was hoping to get kind of like a brush or like a sponge
Mm-hmm.
to like look so that I didn't have to put like my fingers like directly into it. So I asked a Sephora employee, and she was like a white woman, and I asked her, I was like, "Hey, like, can you just like help me out? I think I just need something to like to sample this with."
Mm-hmm.
And she was like friendly, but she was like, "Yeah, yeah. Well, we have sponges over there," and this was like a whole aisle like next to me. And she was like, "Well, we have sponges over there. I'm not gonna touch what you're gonna much, but I think yeah, we have them over there." And like
Wow.
a part of me was like, "Skirt." I was just, I was like, it just stop. It
Mm-hmm.
makes you be like, wait, was that an Asian related racist thing, or am
Mm-hmm.
I overreacting? Did I take that too personally? Right? Like all of the
Mm-hmm.
things, all of the thoughts went through my head. But then, like as somebody that does this research, I was like, no, this is how marginalized people of any group have to feel. They always have to feel like was that me? You know what I mean? And I
Mm-hmm.
realized I was like, no, it's probably not me. It's probably her,
Mm-hmm.
And so, I mean, I was polite. I was like, okay, like, thank you very much for your help. And then it was really funny because she gave me like a card leaving out of like, how was your experience with us today? She was like, please, like, and it was specifically to her. It was like,
Mm-hmm.
like just give us feedback. Maybe she was like an employee, I'm not sure, but she was like, yeah, I would really appreciate it if you fill this out and you can be eligible to win a gift card or
Uh-huh.
something. And I was like, I took it and I was like, yeah, thank you. Have a like great rest of your day. And I was like, girl, I got nothing nice to say about you, so I'm not gonna go.
Wow, wow, wow.
Yeah, like things like that.
Mm-hmm.
So it's a thing, and um, but I talked to my Asian identifying friends about it, and even that like sense of like, what the heck, like,
Mm-hmm.
that's so like gross, like, girl, give me her number, like give me that
Mm-hmm.
Sephora's number, I'm gonna call, like even that sense of camaraderie for me, I think was really encouraging and uplifting, and I was able to get it off my chest,
Mm-hmm.
and gain support around it. And that felt really good, even though it was definitely a negative experience that had me leaving feeling some sort of way.
Mm. That's interesting how you talked about, well, is it me? 'Cause you know how you kind of took a step back to really even see if that was kind of a racially charged situation.
Mm-hmm.
My wife actually had something similar. Well, not the situation, but we were in Las Vegas, and on our way back, as we were going through security at the Vegas airport, right
Mm-hmm.
after she walked through, she said she saw the security guy get like a can of disinfectant and like spray it in the air. but the thing is, like, I was watching and he wasn't doing that before. So for her,
Yeah.
like, I had to like talk to her and say that probably was a racist situation.
Yeah.
But for
Oh,
her,
yeah.
she just said, no, I think he was just being, overly cautious. He probably would have
Yeah.
done, so I think that way of kind of being in denial, kind of almost, is that I feel like that's
Mhm.
pretty common for Asian Americans. Is that right? You think?
Yeah. I won't even say Asian Americans. I think it's any people of color,
Mm,
women, like really anybody with an identity that has historically been disadvantageous,
mm,
right? Right, like sexist comments, like I think I hear a lot of women being like, "Was that sexist? Like, did he just invalidate my like opinion or comment
mm,
or feeling because like he's a guy and I'm a girl and he chalked it up to being like, oh, you're being like such a woman right now. You know what I mean? Like,
mm,
like girls are like that. Girls are crazy, and like women, even, this population is kind of like, right. But so that's a shared experience. But most of the times it's because of these, right, like systems um, that make us try to trust, right, that they have their best, like our interests at heart, but
mm,
a lot of systems at large do not exist for us and they're not to serve us. They are, like their primary interest is of a very specific population. So I think, yeah, it's super natural for us to want to go throughout the world assuming the best. How could we be psychologically safe or sound if that wasn't the case, right?
mm,
But um, but I think in those kinds of instances, our gut instinct is usually right.
I see. Well, that's good to know. And so, then last piece of kind of advice for the Asian American community,
Mhm.
when someone does share a situation or an experience they had that they think was, racially motivated,
Mhm.
what is the best way that we can support this person? Is it to say, oh, like, that's messed up, and to encourage them, or is it to say, hey, maybe that situation wasn't really what you were thinking? Like, what is most helpful for that
Mhm,
person?
mhm. Yeah, so I think first it's always to validate.
Mm,
So, whether or not factually it was a racially charged experience, and there really isn't such a thing because, like, how could you prove that it was like a fact or not, right?
right.
We can't read people's intentions or minds. So, even if I asked that woman at Sephora, did you mean to be racist to me? She could straight up be like, never,
Right. Right.
So again, like there isn't a fact to this. Like what is most important is how that person experienced that
Mm,
and their reactions to the situation and to validate that, like that must have been really hard for you. And what you're like sharing with me and what you're feeling right now makes a lot of sense to me.
mm,
So just to kind of like hold space, I think, for that person, that in itself is actually incredibly healing, incredibly encouraging. But I think if you want to move to the space of like advocacy, right? So like that is kind of that space of being a safe person for that person.
mm,
Um, for whoever experienced kind of these visceral experiences. But if you want to move kind of one step further, it would be advocacy, right? And that was kind of what my friends did of just like, do you want me to act on your behalf? Because I realized that you experienced something that was unjust, right? And so
mm,
I will go and be kind of your advocate.
mm.
And so, my friend who was like, I will call us Sephora, I will find out who she is, and, I will make sure you at least get a Sephora gift card,
Mm,
um, it's that like sense of action of saying like, hey, I feel this with you and I'm going to put it into kind of my like a behavior, right? Like a something I can do for you.
mm,
But I think kind of at the root of all of this, right, whether it's just being encouraging, being a safe person, or moving into action of advocacy, you always want to put the person um, at like in the center, right? So a lot of the times, like
mm,
we have a tendency to hear someone's story and relate it to some past experience that we've also had, right? So this fury that we've experienced because we're looking for context, right? Like
mm,
If you tell me that you stepped on like someone stepped on your foot, I'm going to recall a memory when somebody stepped on my foot and how badly that hurt, right? To
Mm.
be able to relate to you and understand what you're going through. But that happens a lot in kind of these very nuanced and complex situations too. So a lot of the times what ends up happening is the attention and the focus and the emphasis is taken off of the person that actually experienced this, and it becomes kind of about you, and it comes
Mm.
about your reaction, what you would have done about it, what you think is the proper measures, right, to be able to deal with this. But you actually really want to put the ball back into the person's court, right? Like, what do you think would be helpful? And that's a question actually that I think is beneficial to be very frank about in a lot of situations that we don't do often.
Right.
Just saying, hey, what would be helpful for you? And can we ideate on that together? I can be a thought partner for that if you don't quite know what that is yet,
Right.
and then even that process I think is really empowering to the person because they feel cared for, that someone is asking them those questions,
Mm.
and they're willing to put it into action if that's what you want, right? But even just to have that conversation I think is something that we're not doing as well, right?
Mm.
Something that can be healing to our community in a lot of ways.
No, that's great. That's awesome. I would have never thought to do that, but yeah, that's really good advice. So, but before the last question I wanted to ask you is, you are a Christian Asian American studying psychology and working as a therapist in the clinic. Does your identity as a Christian influence how you approach your therapy sessions, or even the way that you think about psychology, or does it not?
Yeah. Oh, absolutely. I think, um, yeah, I think because the root of kind of how I explain anything, human pain, human joy,
Mhm.
connection, love, loss, grief, um, hurt, is in light of my identity as a Christian,
Mhm.
I can't not, you know,
Mm.
um, have that lens, I think, in whatever I do. Um, admittedly, when I first started, actually, my faith was very shaken because you're learning all of these things about the human experience that don't include God, right? Like
Right.
academia is like, right, it is godless,
Mm.
because it relies on science, right? And so I think I went through majority actually of my program so far really, really struggling and wrestling because I felt like I could explain everything about human life without the gospel,
Mm.
and I almost resented and questioned whether or not I had just believed in kind of the core tenets of Christianity without really actually questioning it or having enough knowledge to question it, like enough,
Right. Right.
And so I think again, and honestly, like I'm still going through that. I
Mm.
think I would not be like truthful to myself if I said that I was like completely out of that.
Mhm.
But I don't know. I think my relationship with God is very interesting in that way, that the only way I grow is like by being pushed to these bounds, right?
Mhm.
Intellectually, spiritually, and emotionally. But something that I see in my patients time and time again, because I sit with them through kind of really like the most difficult parts of them and their lives,
Mhm.
is the need for uh, a love that doesn't exist anywhere else,
Mm.
and um, yeah, that doesn't dry up, that isn't earned, and isn't contingent, like on acclaim or desirable, attractive, traits, and so yeah, and someone to truly deeply see us and know us and still want us, you
Mm.
know. Um, yeah, I think Oh gosh, like I'm like getting emotional because I think like if I could be the person that gives that to all of my patients, I don't think they wouldn't need me, you know. They wouldn't need any like really, like any kind of care.
Mm,
But and so I think seeing maybe human depravity in those moments and like seeing the answer as that love, um, like has made me cling to my relationship with God in different ways that I didn't expect when I started this work. Um, and then I'm brought back to how I got started. You know, when I was 12 and I was listening to Dr. Joe speak, all the things that she said that resonated with me was because my relationship with my parents were really difficult and their relationship with each other was really difficult. And it was really difficult being an immigrant, you know, and like all, right, all of these things. Um, and I think that like still small voice for me that feels really called into this field, um, is the last voice that I hear before I like go to sleep, you know?
mm,
Um, because sometimes it is a thankless occupation as well.
right.
You're taking on like you're taking on someone else's burdens and hardships and
Yeah.
their deepest, darkest secrets and thoughts and desires and motivations and failures. Like that is a lot. And
Mm,
so, um, and to do that well, right? Like you need, like I need to be a certain type of person. And all of my flaws and my like sinfulness and the things that I struggle with, I really have to be active on working on that because it influences, I think, my therapeutic relationship again as well to the people that I serve. And so again, having to be intentional about like that self growth makes me turn to God all the time, right? Like God, I don't have the answers of how to be different, any different than how I am right now. You know,
mm,
um, I've also been shaped by my environment, my parents, our socioeconomic status, my, like being an immigrant, me being Korean, me being a woman, that has, concocted like who I am and like really, really good things about me, but also like the really, really bad things about me. And so like, how do I move forward into becoming a person that can be as close to you that can give that kind of love to each and every person that see and touch, you know?
wow.
And so it makes me feel hopeful because it's not on me, you know?
Mm,
And even the growth that I've experienced as a person, I would have never been able to do like on my own power or intelligence or degrees, like all of
mm,
that. Like it's not because of any of that, like it's truly because God did a lot of like surgery in my own heart and like very graciously carried me through uh, seeing myself as I am and really like honoring parts of that, but also dealing with parts of that too. And
mm,
so because I see that transformation in me and kind of my helplessness when it comes to making those changes within even my own self and my own life, I think um, I can only hope for that, like for the people, like my patients and the people that I serve. And I just care about the Korean American community in general so deeply. I'm really involved in the Korean American Coalition, which is like a nonprofit in Atlanta that serves
mm,
kind of um, a wide gamut of needs in the Korean community, but we focus a lot on civic engagement and,
mhm,
getting people represented in that way. Um, and so God gave me this heart, and I think it would have never been from my like own wellspring,
mm,
and I think to walk in that first keeps me in check because I completely realize how blessed I am to be so well educated and to have the opportunities that I do and even the platform that I do and even people letting me be their therapist. Sometimes I'm like, are you sure? No, like truly, sometimes I'm like, wow, like God, can I do this?
mhm,
Like, am I equipped for this? And many days, more days than not, I feel like I can't, like, cause I know how fallen I am and how much I struggle. Um, but that makes me like see God all the more, and so that strength that I think I get from him, and my relationship with him is the posture that I try to bring into my clinical work too.
Mm.
And I like pray for my patients,
Wow.
because at the end of that hour, they go off into their own lives and into their worlds, and I don't see them for
Mm.
until next week.
Yeah.
And again, like I occupy such a small part of their lives. It's 1 hour every week,
Mm.
and the struggles that they're bringing into session with them is the thing. It's a 24/7 life consuming, distress. And so, um, the times when I have sessions where I'm like, wow, we got through a lot and I see this person as they are, but holy moly, like I have to let them leave, and
Mm.
going to carry this hurt with them. And I feel so powerless, when that happens.
Mm.
So yeah, I pray for their week, and I pray for God to keep them and sustain them. And I pray like He makes me, a better tool, a more sharpened tool.
Mm.
And just it's just a lot of like reliance,
Mm.
I
Yeah.
think I'm kind of saying the same things like over and over again, but um, yeah, it's been a very big mirror to, I think, like my shortcomings and like my pain and my past,
Mm.
but also made me very, very aware that, despite my clinical training, despite my like research background, none of that is enough to, redeem humanity.
Mm.
And like there's only one that that can do that. And so, I find myself relying on him a lot because
That's
of that.
awesome. Wow.
Yeah.
Yeah, especially because you're in a field where you have so much authority over someone else, and they're probably relying on you to help them navigate through some of the most like intimate things of their lives. To
Mhm.
have something that you can rely on in turn, I think is that's great, because I'm sure it can get overwhelming a lot of the times, right? Having to like you were saying, take on the burden of other people's issues, and it's not just one person; it's multiple people whose burdens you have to carry. So that's great. That's great. Anything else? Wow, I think we're at like an hour and a half. This is super informative conversation. I'm glad we had you on. Was there anything that you felt we should talk about that I missed?
Mm. Yeah, I think, it's not anything you missed, but I
Mhm.
think if I were to just kind of put an add on in there,
Mhm.
is that I am like so happy to have these conversations, like what, on an individual level or like a group level. Like I really want to be, I got into this field because I want to be a part of the solution of
Mm.
destigmatizing mental health for the Korean community, Asian American community at large for sure. And so I think a lot of the times, like people like me, in the mental health field, or people, like kind of in these like doctorate, whatever, doesn't mean much.
Mhm.
Um,
No,
like
I'm
I
pretty
just
sure it means a lot.
it means something, but like I just feel like the idea is that we're so inaccessible. You know what I mean?
Mm.
Like, but I would love to get coffee and like talk through these things. And I can't be your therapist.
Mm.
Um, right? But I can refer you to one if you are interested in that,
Mhm.
But again, like I think just to have conversations about what mental health looks like in the Asian American community, would love to sift through that with someone,
Mm.
and if they want clarity on kind of an experience that they've had, like would love to just kind of be a listening ear, and make myself available to those for those conversations,
Yeah.
So I think I want to be like, I hope to use this platform to make that really crystal clear that, I think folks, uh, yeah, kind of have this mystified, idea of us, like especially kind of on the other side, like as the therapist, as the clinician,
Mm.
and like someone that is getting their PhD, and yeah, but it's like absolutely not. I cherish, connectedness and relationships a lot. That's the most important thing in my life, and especially if it's around mental health. I would love to yeah, hold space for I think anybody that wants to have these conversations in a formal or informal way too.
Wow. Oh, wow. That's awesome. Oh, then, you know what? If you listeners out there resonated with anything we talked about, or, you had questions to our guest, soon to be Dr. Hannah Lee, and you want to connect with her, you can feel free to email me at ihthtpodcast@gmail.com. That's just, I hope they hear this abbreviated, podcast@gmail.com, or on Instagram. I'm going to tag her in the post that I promote this episode on. That's just, I hope to hear this, or on Twitter at IHTHT podcast. So, anyways, you want to communicate with her and get in contact with her, feel free to let me know, and I'll connect you with her. And you guys can have your conversations. And especially because, yeah, you gave your blessing to do that. If there's any part of you that is curious about this and wants to dive deeper, please feel encouraged to do so. And yeah, thank you guys for listening. And thank you, Hannah, so much for being on. I really enjoyed this conversation. It was really eye-opening for me. And I think we got a lot of good content out of it. And I'm actually going to take you up on that offer as well. I'll contact you. I would love to just sit down and talk more about this. I
Sure.
feel like
Yeah.
it's, and you talked about how you were part of the Korean American Coalition. Oh,
Mhm.
is that the Korean American Coalition? Is that what
It's
it's called?
KC for short. Yep.
Okay, okay. Yeah, that's also something that piqued my interest. So maybe we can work it out where we can have you on a second time to talk about that.
Yeah, KC is like family, so
Yeah.
would love to.
Okay, awesome, great. Well, again, thank you guys for listening. Thank you for being on, and yeah, we'll talk to you next week. Bye, guys.
Bye. Thank you for having me.